The nursing profession is founded on trust, compassion, and an unwavering commitment to patient well-being. Nurses are entrusted with the lives of their patients, and their actions directly impact patient safety and outcomes. This responsibility creates a unique ethical landscape with complex dilemmas. One such dilemma arises when a nurse suspects a colleague's ability to provide safe care is compromised. Impairment, often from substance abuse or mental health challenges, can jeopardize patient safety. A nurse struggling with addiction may exhibit erratic behavior or impaired judgment. Similarly, mental health issues may cause emotional instability or withdrawal. These situations create a profound ethical conflict for nurses. They have a duty to protect their patients from harm, but they may feel loyalty to their colleague and reluctance to take action. Navigating this requires compassion, professionalism, and commitment to patient safety. Nurses must advocate for their patients and ensure high-quality care. This means identifying potential impairment and taking appropriate action. By adhering to ethical principles and reporting procedures, nurses can create a culture of safety and accountability. Addressing colleague impairment is about ensuring safe and effective performance. By fostering a supportive environment, healthcare institutions can create a culture of transparency and accountability that benefits everyone involved. In healthcare, patient safety is the foundation of quality care. It guides every decision and action within the healthcare setting. When a nurse suspects a colleague's impairment, their ethical obligation to act is paramount. The consequences of inaction are too grave to ignore. Impaired judgment can lead to medication errors and misdiagnosis. This can result in serious complications and even loss of life. Reporting a colleague's impairment is an act of courage and responsibility. It upholds the highest standards of care, ensuring patient safety in a supportive environment. And ethical principles guide our actions, providing a moral compass in the complex landscape of healthcare. Every decision we make, every step we take, is influenced by these core values. In situations where a colleague's impairment may jeopardize patient safety, it is these principles that remind us of our unwavering duty to protect those in our care. The principles of beneficence, non-maleficence, autonomy, and justice are not just theoretical concepts. They are the bedrock of our practice. By adhering to these principles, we ensure that our actions are not only legally sound, but also ethically justified. This commitment to ethical practice fosters a culture of trust, respect, and accountability within our healthcare teams, ultimately enhancing the quality of care we provide to our patients. All right, let's dive into a step-by-step guide on how to approach ethical responsibilities in healthcare. First, always prioritize patient welfare above all else. This means understanding their needs and ensuring they receive the best possible care. Second, maintain confidentiality at all times. Protecting patient information is not just a legal requirement, but a moral one too. Third, be transparent and honest in all communications. This builds trust and strengthens the patient-caregiver relationship. Lastly, continually educate yourself. The healthcare field is ever evolving, and staying informed ensures you provide the highest standard of care. When considering ethical responsibilities, there are a few essential points to keep in mind. Respect for patient autonomy is crucial. This means acknowledging their right to make informed decisions about their own health. Additionally, always act with beneficence, aiming to do good and prevent harm. Non-maleficence, or the commitment to not inflict harm, is equally important. And don't forget justice, ensuring fair and equitable treatment for all patients. These principles form the foundation of ethical healthcare practice. Upholding standards in healthcare is vital for maintaining trust and integrity. Adhere to professional codes of conduct and guidelines established by reputable organizations. Regularly participate in training and development programs to keep your skills and knowledge up to date. Engage in reflective practice, constantly evaluating your actions and decisions to ensure they align with ethical standards. By doing so, you not only enhance your professional growth, but also contribute to a culture of excellence within the healthcare community. Navigating ethical challenges can be, well, quite complex, but it's an essential part of healthcare practice. When faced with an ethical dilemma, take a moment to gather all relevant information. Consult with colleagues or an ethics committee if needed. Consider the potential outcomes of different actions and weigh them against ethical principles like autonomy, beneficence, non-maleficence, and justice. Remember, it's okay to seek support and guidance when needed. By approaching challenges thoughtfully and collaboratively, you can make informed, ethical decisions that prioritize patient well-being.